We stay in Nigeria's capital, where we understand that the Federal House of Representatives in Nigeria has urged the Nigerian federal government to declare a state of emergency in the health sector and allocate significant votes to it in the 2024 budget estimate. This followed a motion by Fayinka Oluwatoyin during plenary in Abuja titled Need for the National Primary Health Development Agency to collaborate with relevant health agencies and states and local governments to ensure the functionality of primary healthcare centers. Oluwatoyin noted that Nigeria is faced with alarmingly high rates of dilapidated health facilities. According to him, it is estimated that Nigeria has about 39,983 hospitals and clinics as of 2020. The primary healthcare centers accounting for about 34,000, which is 86%. He, however, said that only 20% of these primary healthcare centers are functional, particularly in rural areas lacking adequate facilities and staffing. Now, joining me live to discuss this is Dr. Chima Onoka, a medical doctor. A warm welcome to you, Dr. Onoka, and thanks for joining us on the news. Hello, Dr. Onoka, are you there? Could you?
Yeah, good evening.
Okay, good evening to you. Let's get straight to it, Dr. Onoka. The Nigerian House of Representatives has called on the federal government to declare a state of emergency in the health sector. What do you make of this declaration? Hello, Dr. Onoka, can you hear me?
Great thing that is going on. But there's that recognition that it's a state of emergency that actually needs to be declared. That is correct. Where we are at the moment is actually very critical. If you ask me when the state of emergency needed to be declared, it's probably 5, 10, 15 years ago. As you know, we did not go close to the MDG goals. We did not go close to all the other things that have happened previously. And there are things that are staring us in the face. It is said that we are completely off track when it comes to the Sustainable Development Goals, the SDGs. So it's coming, and it's good that there is this sense of urgency about it, and that people are raising their voices to say health. That's the question of the state of emergency.
Now, Dr. Onoka, you said this state of emergency should have been declared a long time ago, but as we speak in 2023, the issues just seem to be growing bigger and bigger. While the sector grapples with the effect of brain drain, infrastructural deficiency has been one of the major unresolved issues. What should be done to address some of these issues?
Sorry, if you can take that again.
I said we already have a problem, an issue with brain drain in the medical sector. Another challenge is infrastructural deficiency. It remains a major unresolved issue. What do you think the government should do to address some of these issues? And is there enough pressure from the Nigerian Medical Association?
Well, if I got you clearly, like I said, I'm really struggling. For medical doctors, and not just doctors, but of course, nurses, all of the people in the health sector, there's been this need over the years. It's clear that something really needs to happen. There is a huge shortage. People talk about how many doctors do we need per patient or for the population. The truth is that we don't even have the correct statistics, because the tracking of people, whether they are going in or going out, is not done in a way that they are professional issues. Lots of people have left, and so we actually don't have statistics. That is correct. But everybody knows that health professionals cannot provide when people cannot pay. And payment is is an issue. More than 75% of Nigerians have to pay out of pocket. Yeah. So people are not paying, not going for care, and going to very wrong places to seek care. That's a problem, big issue. That only worsens the outcomes. So when you have that situation, I mean, the basic thing that you want to see is that there's expansion of health insurance coverage. I mean, gladly some things are happening, like the NHIS just released its a 2023 version of the operational guidelines. The Honorable Minister of Health will launch that. With work that the team at the NHI, have been doing. So, but hopefully those things can move us forward. But the problem is that there's a huge problem. Nigeria is only second to Chad in terms of life expectancy. That is, it means we're second worst in the world in terms of life expectancy. If you're going to start from that point, then issues of declaration of emergency, a huge thing that needs to happen. It will be sad to see Nigeria as having the worst life expectancy, but that's really what it is. Look at the African countries that we are comparing with above 50 years and all of that. Nigeria is like 52.5 in terms of average life expectancy. That's how bad things are. Care is poor. Financial protection is not there. And it needs to start somewhere. We also know that people's economic power has collapsed so bad, so they can't even pay for.
Quite a lot to address when it comes to the medical sector in Nigeria. Thank you very much, Dr. Chima Onoka, for your time and insights. We do appreciate it. Thank you.